friends, I am Soham Bera, Senior Consultant Optometrist from India. Today I am going to tell you about diabetic retinopathy. Friends, actually we have done a video what is diabetes and what is type 1, type 2. If you don't see this video, please go to our channel, scroll down and you will find what is diabetes and type of diabetes. Let's start it with today's subject, that is diabetic retinopathy. Diabetic retinopathy is a condition that occurs in people who have diabetes. It causes progressive damage to the retina, the light sensitive lining at the back of the eye. Diabetic retinopathy is a serious sight-threatening complication of diabetes. Diabetes interferes with the body's ability to use and store sugar or glucose. This disease is characterized by too much sugar in the blood, which can cause damage throughout the body, including the eyes. Over time, diabetes damages the blood vessels in the retina. Diabetic retinopathy occurs when these tiny blood vessels leak blood and other fluids. This causes the retinal tissue to swell, resulting in cloudy or blurry vision. The condition usually affects both eyes. The longer a person has diabetes, the more likely they will develop diabetic retinopathy. If left untreated, diabetic retinopathy can cause you blindness. Symptoms of diabetic retinopathy include seeing black spots or floaters, blurred vision, having a dark or empty spot in the center of your vision, difficulty seeing well at night. When people with diabetes experience long period of high blood sugar, fluid can accumulate in the lens inside the eye that contains focusing. This changes the curvature of the lens, leading to blurred vision. However, once blood sugar levels are controlled, blurred distance vision will improve. Patients with diabetes who can better control their blood sugar level will slow the onset and progression of diabetic retinopathy. Often, the early stage of diabetic retinopathy have no visual symptoms. That is why the diabetologist, even eye specialist, recommends that everyone with diabetes have a comprehensive dilated eye examination minimum once a year. Early detection and treatment can limit the potential for significant vision loss from diabetic retinopathy. Treatment of diabetic retinopathy varies depending on the extent of the disease. People with diabetic retinopathy may need laser surgery to seal leaking blood vessels or to discourage other blood vessels from leaking. Your eye specialist might need to inject medication into the eye to decrease inflammation or stop the formation of the new blood vessels. People with advanced cases of diabetic retinopathy might need a surgical procedure to remove and replace the gel-like fluid in the back of the eye called the vitreous. Surgery may also be needed to repair a retinal detachment. This is separation of the light receiving light limiting lining in the back of the eye. If you are diabetic, you can help prevent to slow the development of diabetic retinopathy by taking your prescribed medication, sticking to your diet, exercising regularly, controlling high blood pressure, avoiding alcohol and smoking. There are mainly two types of diabetic retinopathy. One is non-proliferative diabetic retinopathy and we call it NPDR. Is the early state of disease in which symptoms will be mild or non-existent. In NPDR, the blood vessels in the retina are weakening, causing teeny bulges called microaneurysm to produce from their walls. Now second proliferative diabetic retinopathy means PDR is the more advanced form of the disease. At this stage, new fragile blood vessels can begin to grow in the retina and into the vitreous. This gel-like fluid that fills the back of the eye, the new blood vessels may leak blood into the vitreous and clouding vision. Diabetic retinopathy results from the damage diabetes caused to the small blood vessels located in the retina. This damaged blood vessels can cause vision loss. Fluid can leak into the macula, the area of the retina responsible for central vision. Although small, The macula is the part of the retina that allows us to see color and fine details. The fluid causes the macula to swell, resulting in blurred vision. In an attempt to improve blood circulation in the retina, new blood vessels may form on its surface. These fragile abnormal blood vessels can leak blood into the back of the eye and block vision. Diabetic retinopathy is classified into two types. Already I have told you about this. One is non-proliferative, second is proliferative. First come to non-proliferative diabetic retinopathy is the early stage of the diabetes in which symptoms will be mild or non-existent. In NPDR, the blood vessels in the retina are weakened. Tiny bulges in the blood vessels called microaneurysm may leak fluid into the retina. This leakage may lead to swelling of the macula. The second one is proliferative diabetic retinopathy. Proliferative diabetic retinopathy or PDR is the more advanced form of the disease. At this stage, circulation problem deprive the retina of oxygen. As a result, new fragile blood vessels can begin to grow in the retina and into the vitreous, this gel-like fluid that fills the back of the eye. The now new blood vessels may leak blood into the vitreous, clouding vision. Other complications of PDR include detachment of the retina due to scar tissue formation and the development of glaucoma. Glaucoma is an eye disease in which there is progressive damage to the optic nerve. In PDR, new blood vessels grow into the area of the eye that drains fluid from the eye. This greatly raises the eye's pressure, which damages the optic nerve. If left untreated, PDR can cause severe vision loss and even blindness. Risk factors for diabetic retinopathy include: first, diabetes. People with type 1 or type 2 diabetes are at a risk of developing diabetic retinopathy. The longer a person has diabetes, the more likely he or she is to develop diabetic retinopathy, particularly if the diabetes is poorly controlled. Race. Hispanics and African Americans are at greater risk for developing diabetic retinopathy. Now India is also at the path. Medical conditions. People with other medical conditions such as high blood pressure and high cholesterol are at greater risk. Fourth, pregnancy. Pregnant women face a higher risk of developing diabetes and diabetic retinopathy if a woman develops. Now, how is diabetic retinopathy diagnosed? Diabetic retinopathy can be diagnosed through a comprehensive eye examination. Testing with emphasis and evaluating the retina and the macula may include: first, patient history. To determine vision difficulties, presence of diabetes and other general health concerns that may be affecting vision. Visual acuity measurement to determine how much central vision have been affected. Refraction to determine if a new glasses prescription is needed. Evaluation of the ocular structures including the evaluation of the retina through a dilated pupil examination. Measurement of the pressure means within the eye. Check intraocular pressure, means eye pressure. And supplementary testing may include retinal photography or tomography to document current status of the retina. Fluorescent angiography to evaluate any blood vessels, abnormal blood vessels growth. Now, how diabetic retinopathy is treated? Laser treatment photocoagulation is used to stop the leakage of blood and fluid into the retina. A laser beam of light can be used to create small burns in areas in the retina where the abnormal blood vessels is grown. Try to seal these leaks. Treatment for diabetic retinopathy depends on the stage of the disease. The goal of any treatment is to slow or stop the progress of this disease. In the early stage of non-proliferative diabetic retinopathy, regular monitoring may be the only treatment. Following your doctor's advice for diet and exercise and controlling blood sugar level can help control the progression of this disease. If the disease advances, the blood vessels can leak blood and fluid into the retina, leading to macular edema. Laser treatment photocoagulation can stop this leakage. A laser beam of light creates small burns in areas of the retina with abnormal blood vessels. Try to seal the leaks. Widespread blood vessels growth in the retina, which occurs in proliferative diabetic retinopathy, can be treated by creating a pattern of scattered laser burns across the retina. This causes abnormal blood vessels to shrink and disappears. Within this procedure, some slight vision may be lost in order to safeguard of central vision. But friends, one thing you have to remember, first you have to control your blood sugar in any way, because if you don't control your sugar, then there is no other eye treatment can preserve your vision. First you have to control, and this is the main treatment of diabetes. You have to control the diabetes. So friends, this is it. Stay safe, stay healthy. Bye.